Hello, my name is Kate. I'm going to be the nurse practitioner here with you today, and we are going to be doing a modified neurologic exam, essentially testing your cranial nerves, your balance and coordination, as well as your sensory motor exams, and then we are also going to do an overview of your musculoskeletal exam as well, okay? And so can you tell me your first and last name, please?
Christopher Hughes.
And can you tell me the date today? That would be the month, the day, month, date, and year.
August 11th, 2022.
Okay, great. And then we will move on to the cranial nerve section of the exam. And I have something here for you to smell to test your olfactory nerve. And so if you could close your eyes, please, and kind of tell me what you smell here.
I smell like coconut almond.
Oh, yeah, that's very specific, and that is exactly what we have here. Good, you can open your eyes. We're going to look at your optic nerve, and so to do that, we're going to test your vision on both sides. So I'm going to cover your right eye here, and can you see my full face okay here?
I can.
And then I'm going to, you're going to keep looking at my nose, and I'm going to hold up fingers in 4 different areas, and you are going to tell me how many fingers you see, okay?
Okay. 1, 2, 1, 2.
Good, and then we're going to switch sides here. So I'm going to cover your left eye, and again, you see my whole face okay there? Okay, and how many fingers do you see here?
1, 2, 1, 2.
Good, okay, very nicely done. We're going to move on to your extraocular movements, which test a component of cranial nerve 3 and then 4 and 6 as well. And so if you see my finger here, we are going to follow my finger with just your eyes. Good. Down, good, back up across the midline, and up, and down, and back to the middle. Okay, very nicely done. Any double vision, blurry vision whenever you do that at all?
Nope.
Okay, beautiful. I am going to grab my ophthalmoscope here so we can finish cranial nerve 3. If you would mind removing your glasses, please.
Okay.
And if you can just pick kind of a spot on the back wall there to look at and focus on. And I'm just going to be looking at your pupils 2 times here, so for constriction and then a consensual response, which looks well here. And then same thing on this side. Okay, beautiful. And then, actually, if you mind keeping your glasses off, I'm sorry for the last part, just to check accommodation. You see my finger here, and you're going to follow it all the way in. And so we have appropriate convergence of your eyes, and then you get pupillary constriction there as well, so that's accommodation. Yeah, Bethel, you can put your glasses back on there.
Okay.
We'll move on to cranial nerve 5, and there's actually 3 branches of this nerve. So you're going to I'm going to touch both sides of your face with my fingers, and you're going to tell me whether it feels the same on both sides.
Okay.
So same here.
Yep.
And how about here?
Yes.
And down here as well?
Yes.
Okay, very nicely done. Cranial nerve 7 is your facial nerve, so I'm going to ask you to do a few different things with your facial expression so that we can test the function of this nerve. So the first thing is if you could raise your eyebrows up and then frown them down. And then if you could close your eyes really tight shut, like super tight, and I'm going to try to open them up. Good, very nicely done. And then if you could puff your cheeks out and then kind of make a fish face, a kiss face. Good. And then give me a big smile. Very nicely done. Moving on to the lower cranial nerves here, if you could open your mouth for me, please. And I'm sorry, I didn't have my light ready there, but here I come. Okay, and then say ah. Okay, good, and we get good, your uvula is midline, you've got good symmetric soft palate elevation on both sides there. I could test your gag reflex, but instead I'm just gonna have you give me a really good cough. Good. Otherwise, I could use a tongue blade to test your gag reflex on both sides if I had concerns about your bulbar function, which I do not. And then we are going to do the last couple of things here, which is if you could turn your head towards my hand here. Good, and come back the other way. Nicely done. You're going to push down with your forehead against my hand here. Good, and then come backward. Nice, and then shrug your shoulders up for me, please. Okay, very nice. And so that completes our, oh, just kidding, I almost forgot our auditory nerve. I could almost forget that with my tuning fork here. And so this is going to kind of make a buzzing noise, and you're going to tell me whether you hear it the same on both sides here. You hear it there? And then same here, and same on both sides?
Same on both sides.
Okay, very nice. All right, and then we're going to move on to the sensory kind of portion of this exam, sensory motor a little bit before I have you get up and walk to test your gait. So we'll kind of just do everything that's required for you to be sitting first. And so we're gonna do a little bit of light touch, which I'm gonna use my fingertips for that, and then versus sharp touch, which I have paper clip kind of opened up here, okay? So if you would mind kind of flipping your hands out, you can just rest them on your legs, and I'm just gonna, so if you feel how that feels kind of sharp there, and you're gonna just let me know if it changes as we go up your arm here. Any difference there?
Yep.
And on this side as well. And any difference there? Okay. And then if you got across your legs, good, same thing down here, that's that same touch here. Coming up your leg, any difference there?
Yep.
And then on this side, any difference here?
Yep.
Okay, great. While I'm down there by your feet, we'll test proprioception. And so if you would mind kind of maybe crossing your legs for me a little bit there so your foot is up. And then close your eyes, please. And I'm going to move your big toe, and you're going to tell me if I'm moving it up or down, okay?
Okay. Down. Down. Up.
Great, and let's switch legs. Good. Oh, sorry about that. Okay, and I'm going to move it again. Same thing, eyes closed. You're going to tell me if I'm moving up or down.
Up.
Yeah, good.
Down. Down.
Okay, great. Nicely done. Go ahead and uncross the legs there. We will move on to having you identify a couple of objects whenever I put them in your hand. Of course, I have now misplaced my pen. So that's all right, we'll switch. So close your eyes there,
Okay.
and let me see this hand. And I'm going to put an object in your hand, and you're going to tell me what it is.
That would be a ring.
That's right, thank you very much. You can open your eyes. Actually, we'll go back to that. If you could give me just one hand, actually, it's fine for right now. I'm going to draw a letter in your hand, and with your eyes closed, you're going to tell me what letter I'm drawing, okay?
S. A.
Okay, great. We'll move on to this hand.
H. S.
Very nicely done. With your eyes closed again, you're going to tell me which body part I'm touching, and specifically, so, you know, right hand, left arm, something to that extent, okay? And just, this is just my fingers here.
Right forearm. Left shoulder. Right shin. Left foot.
Okay, great. Now you can open your eyes. And we are going to do what's called 2-point discrimination. So that same safety pin that I was using before. Before I was only using one part, and this time we're going to use one and or both. And so if you could give me your hand, please. And you're going to, first we'll do it with your eyes open.
Okay.
So you can kind of see what we're doing here. So that's one touch
Okay.
and 2 touches,
Okay.
right? And so you're going to, with your eyes open, what do you feel here?
2. 1.
Okay, great. Now you can close your eyes and let's do the same thing now.
1. 2. 2.
Okay, and then let's switch hands.
1. 2. 1.
Very nicely done. Okay. We're going to move on to testing your reflexes here. And so actually first, I'm just going to have you pull your shirt up a little bit to test your abdominal reflex. And I'm going to do this without a reflex hammer because that wouldn't be very nice, but you have a nice abdominal reflex there. And then we're going to work on your upper extremities. So if we can kind of keep your arm nice and loose there. Good. It's a great case. Well, we've got our triceps here. Good. And then for our radial as well here. Good. We'll switch to the other side and break your radialis here. I like it kind of better how you had your, yeah, that's good. Good. Coming up this way. Nice and loose here. Good. And then back down to your radial again here. Good, very nicely done. And then we'll be moving on to your lower extremities. Yep, so if you could sit back and cross your legs there for me, and again, try to be nice and loosey-goosey as we can here. Very nice. And then in order to test your Achilles, I'm going to kind of just gently pull up on your foot here a little bit. Good, and then if we could switch legs here. Again, nice and loose there. Good. And then same thing here. Okay, good. And then we're gonna test for ankle clonus, last part of this. So again, cross those legs, and I'm just gonna kind of, good, nothing there. And we'll do the same thing here. And this is just kind of, again, that kind of sharp push up and no clonus there on either side. Reflexes are +2 throughout, look really good there. So the last part of the neuro exam is actually to have you do some walking. So if you wouldn't mind getting up over to this doorway here, I'm gonna kind of just turn this camera a bit so that we can see your walking. And you're just gonna walk forwards normally, just straight forwards there toward the door. And we're just kind of looking at your posture, the rhythm of your walking, your arm movements, and the sequence of your stride, which all looks nice and normal. This time on your way forward, you're gonna walk forwards on your toes. And we're looking at your balance here. That's fine there. If you wanna turn around on the way back, we're gonna come back on our heels. And the cat is making that a tiny bit challenging, but that's okay. Just part of our animal therapy here. Okay, beautiful, and come on back. And now you're just actually gonna stand with your feet together, and you're gonna close your eyes, and this is the Romberg test, and we're just watching for any balance issues here. Very nicely done. Okay, come on over. Obviously, if this were, even if you were a patient that had any kind of issues with your balance or coordination, I would stand very close to you when we were testing that Romberg test. Nicely done. And so that concludes our neurologic exam. Oh, sorry, I'll move that back. Thank you for pointing that out. There we go. Okay. And so now we're going to move on to the musculoskeletal exam. A lot of this is just going to be me looking at your various muscles, bones, and joints. We actually did a fair amount of testing of your range of motion and muscle strength whenever we did your neurologic exam, so we don't really need to do anything with your cervical spine there. I will test your temporomandibular joint here. I'm inspecting that first, and I'm not noticing anything abnormal, and I'm palpating, and again, not feeling anything. Now, if you could open your mouth, and go ahead and shut your mouth. And there is actually do that one more time, and then close. And there is actually a tiny bit of crepitus here on the right-hand side. Do you have any pain with that?
Not usually.
Okay, good. And now I'm gonna kind of just generally inspect the rest of your skeletal structure here, looking at the alignment of your bones, the contour, looking for symmetry, size. I'm not noticing anything abnormal there with your your skeletal system. We'll do the same thing with the skin and subcutaneous tissue, especially over your joints. Looking for any obvious masses, swelling, any abnormalities with the color or skin fold numbers around your joints. And again, not noticing anything abnormal there. And then lastly, I'm looking at kind of all of your musculature in general for tone, and symmetry again, and size again, all of which looks normal. We're going to move on to palpation, and so I'm going to kind of start around your shoulders, and you're going to feel I'm kind of focusing on your joints a lot here, so I do want you to let me know if you feel any tenderness or pain, obviously, when we're doing this. And so around your shoulders, and then around your elbows, around your wrists, and then we're going to test the strength here a little bit. And so if you could actually kind of make chicken wings and hold them up there, don't let me push them down. Good. And then same thing, you push down, I'm going to push up. Good. And then if we can come out with our elbows there, and you push me away there, and then pull me towards you. Very nicely done. And then with your hands, if you could kind of make your fingers out wide and gently push them in. And then now same thing, kind of bring your fingers in and push them out. Yep, very nice. And then if you could kind of flex your wrists up and push against my hands there, and then pull back just with the wrists. Yep, very nicely done. And then we are going to move down to the lower extremities here. So your hips here, if you wouldn't mind moving your arms a little bit, that's good. Any pain there around your hips? Okay, in order to test the strength there, I need you to kind of pick your leg up against my hand. Good, and same on this side. Good, and then if you could lift your leg up and push down against my hand. Good, and same on this side. Good, very nicely done. Any pain around the knees here at all?
Nope.
Again, assessing for any obvious masses or warmth, and I don't see anything there, no swelling. If you could kick your leg out, good, and then pull back. And again, kick your leg out and then pull back. Very nicely done there. And then at the ankle here, any pain around the ankle joint at all? Good. And if you could pull your toes to your nose on both sides there, and then push down on both sides. Okay, very nicely done. And so I'm not noticing anything abnormal with your musculoskeletal system at all. And that will conclude our exam for today. Any questions or concerns?
Nope.
Well, thank you so much for your time. Really appreciate it.
Thank you.